In terms of cases globally, we're at 150.6 million. In the U.S., we're at 32.2 million, and in Alabama, we're at 527, roughly 528,000. So what's interesting, if you look globally, is you've heard about the new outbreaks that are going on, primarily in India and Brazil. So this is a reminder to all of us that COVID is not going away. And what differentiates us here in the U.S. from a lot of other places is the availability of vaccines. So as we talk through some of these numbers today, please pay particular attention to the vaccine events that are coming up. What is important is vaccines are primary prevention. You don't have to rely on treatment, and that's the best way for us to reach herd immunity and go back to normal. So if we look at mortality globally, we're at 3.2 million worldwide. In the U.S., we have passed the 575,000 mark, and here in Alabama, we're just under 11,000. So significant tolls still going on. But that being said, if we look at our trends are actually going in a very good direction. In the last 24 hours here in Mobile County, we added 15 cases of COVID-19. We added 3 hospitalizations, and we were actually down 4 with respect to those currently hospitalized. So again, numbers are going down. If you look at some of the reports, you're going to see some really big, numbers that have been documented over the last couple days. Those are really lab reporting issues. Those are not real numbers. So the importance is to continue to look at the trends and kind of week over week, or those, so that 7-day trend or those 14-day trends. So again, very, very positive. We have started to see, though, from our expanded reports, some slight uptakes or upticks from what we've seen in the previous weeks. And that's based on not lab reports, but on the infectious day. What's concerning there is that when you're in a plateau, you're kind of at a steady state, and you really want to see those numbers to continue to go down. And they have started to go back up a little bit. And that's not only for COVID, but also for influenza. And we don't know if that's because of the relaxing of the masking mandates and kind of a relaxing overall of some of the mitigation activities, the effects of spring break, that type of thing. We have to remember that Mobile sits at the crossroads of 2 major interstates of 65 and I-10. And so we get a lot of travelers that stop here, and there's that opportunity for diseases to be brought into this area and to infect, our people here in Mobile County. So it is still important. 1, get your vaccines. If you've gotten your first one, please complete your series. So we need fully completed series to really get us to that herd immunity threshold. That being said, just want to announce a couple of things here. So on Monday, May the 3rd, we are doing what we're calling a catch-up clinic. So from 9 a.m. to noon at the Mobile, Alabama Cruise Terminal, if you have missed your second dose of the Moderna vaccine, you can come in and we will have Moderna available for you to complete your second dose. From noon until 4, from 1 until 4, thank you, Mark, we will be doing a catch-up clinic for the Pfizer doses. So if you're due for your second Pfizer dose, and remember, Moderna's on a 4-week schedule, Pfizer's on a 3-week schedule. If you've missed those intervals, it's still okay. Please come back and get that second dose so that we'll get that above 90% coverage, so that you will be much better protected than if you've only had the single doses of these 2 vaccines. Then on May 4th, we're going to be back out in the community. So we're going to be doing a second dose clinic for Moderna down at the Dauphin Island Sea Lab Shelby Center. And that's on 101 Bienville Boulevard, Dauphin Island. But all of us know where the Dauphin Island Sea Lab is. Please come down if you're due there for your second dose of Moderna on May 4th. Then on May 6th, we'll be out in Pritchard at the Mobile Baptist Sunlight Association Auditorium. That's at 809 East Seminary Street. Again, in Pritchard. This will be Moderna, again, second dose, and that will run from 1 until 5 p.m. And then following that, on May 7th, we will be out at BC Rain High School from 2 to 6. Again, this will be second dose for Pfizer. So if you've had your Pfizer dose, BC Rain High School, please, from 2 until 6 p.m. What's important there is it gives individuals an opportunity that, picking up kids at 3 or you get off work at 5, there's that opportunity to come in and complete this series. And again, BC Rain, 3125 Dauphin Island Parkway. And then the next day, May 7th, we're out at Mary G. Montgomery High School and Sims, 4275 Snow Road. This is also a Pfizer second dose clinic, also running 2 to 6. And you can kind of see that the last couple of clinics that I mentioned, trying to get out into the community, there are individuals that have either financial or geographic barriers to come into some of these large mass vaccination events that we hold. So if you did get your first vaccine, please come back and complete the series there. There's been some talk in the news. This is not a question from the media, but there's been some talk in the news about the hesitancy of individuals not coming back for their second dose. And that's really due to several different factors. It can be, work related, or you're sick, or your kids are sick, or, things happen in life. So there's no upper limit in terms of the time you can come back in and complete your series. We put a lower threshold on these vaccines of 21 days for Pfizer or 28 days for Moderna because we need your immune system to ramp up and be ready so that when we give you that second dose, it's already been primed, so it really ramps up and gets over that 90% coverage against COVID-19 disease. The other thing that I'd like to announce is not a vaccine event, but it is a walk-in rapid testing offering for the public. So on any Wednesday or Friday, you can come to the Family Health Downtown Health Center here at Keeler. That's at 251 North Bayou Street. And you can get free rapid test COVID testing. So this is our rapid test. Again, no cost to you. We get the results back to you in 15 to 30 minutes. So if you feel like certainly if you're showing symptoms or you think that you have possibly been exposed, it's really important to know your status in terms of SARS-CoV-2 infection, the virus that causes COVID-19. So we do that every Wednesday and Friday from 8 a.m. until noon. Then we go to lunch, and then we come back at 12:30, and we run from 12:30 until 4. And that's every day with the exception of May 7th because we have a freestanding commitment. So on May 7th, we will run from 12:30 until 4 only. So generally every Wednesday, Friday, 8 a.m. to noon or 12:30 to 4 here at the Keeler location, with the exception of May 7th. Again, this is free to the public. Okay, so we had one question from the media this week, which is great. So I don't know if you guys remember the risk indicator maps that we used to talk quite a bit about. So this week, Mobile County went into the very high risk designation. That's based on 3 categories. And so the reason that we moved into the very high risk category is because our number of cases went up by 30. Now, going up by 30 several months ago would have been a blip because we were dealing with the numbers were so big. Now, when we talk about the numbers that we have being relatively small, just 10s and 15s and 20s being added each day, any small little change in those numbers percentage-wise can take us from the low risk indices to the very high risk quickly, because it's based on a percentage change. And so please treat those numbers with caution. We are still overall doing very, very well. But this, we are still watching it because we don't want this to be the beginning of a new peak. So again, coming off spring break and Easter, looking into July, we don't want to be where we were last year, where it was really this time of year through early June that we started to really go up into that high peak of July. So don't be too concerned about the very high risk designation that we're under right now. Under the Alabama Department of Public Health map, it's really based on a percentage change and not an absolute value change, which we have to be cautious